Hello everyone and welcome to the Bayesian Musings podcast. I'm your host Vishnu. So this is an idea that's been on my mind since 2020 and unfortunately it has taken this long for it to come to fruition. Well, it's finally underway, so let's get to it. Firstly, a little bit about myself. I'm an intensive care trainee currently doing my fellowship year in Geelong. I started my training here and have worked in a few other units over my career, and it's nice to finish my training back in Geelong. My goal with this podcast is, well, partly selfish, but hopefully helpful to others too, through my selfishness. So one of the most challenging aspects of my day-to-day work is communication with other specialties about patient care. There are different priorities, clinical acuity and challenges, and often this is hard to appreciate when you yourself are busy and trying to prioritize your list of jobs for the day. All of this can lead to friction, and that's ultimately not really helpful for anyone and just leaves you feeling frustrated and really, really tired after a long workday. That's where this podcast idea came up. Why do different people think so differently? Why are the priorities of that specialty so different to mine? Why don't we see the same issues for this patient? After all, we're meant to practice evidence-based medicine, right? How many different ways can you look at the same problem? Well, this is my attempt to appreciate those different perspectives, why they arise, and how I can learn from them. I'm just as guilty as anyone when it comes to getting annoyed or frustrated by other clinicians. And this is my exercise to learn to be more mindful of my own biases and appreciating where others may be coming from. Along with these ideas comes the notion of how work impacts us as healthcare workers and doctors. Part of that is the whole training pathway stuff. How does one get into training for each different specialty? How are they different? What's required for each? What are the challenges and what's done well or not so well? The other part is how does the training pathway one has chosen and the experiences that it brings along with it affect how we see patients, our relationship to them, and also how one specialty training affects how they see life in general. My own training pathway was a little convoluted and has certainly affected my outlook on life. This was highlighted even more for me when I did a rotation in palliative care, which unsurprisingly is also when the time where the idea for this podcast started brewing. I'm not sure if this is ultimately some self-aggrandizing exercise. After all, everyone and their best friend started a podcast during COVID. That being said, my goal is to learn, and hopefully there's something there for everyone to take away. Hopefully for medical students and junior doctors, it illuminates some aspects of the path ahead for them and may or may not help them choose what's right for them. I'm hoping that for other trainees, perhaps some of their thoughts and feelings are echoed and perhaps offers some insights or perspectives that may help them along their careers. Speaking of medical students, I'd like to thank a current medical student, well, depending on when you listen to this, might be a director of unit or health minister by the time you're listening. But thanks to Sheel for finally making this happen by doing all the hard work with IT and internet stuff that just does not compute with my brain. Grandiose delusions aside, I hope you enjoy listening to the podcast and thank you for your support.